I always ask, do you know anybody with diabetes? Most people say yes. Do you know anybody with diabetes that developed a toe ulcer or some sort of infection? But what most people don't know, especially patients with diabetes, is that the day a patient with diabetes develops a toe ulcer, that day, that moment, is a worse outcome than breast cancer, prostate cancer, and colon cancer combined. More than half will not be alive in 2 years because of how sick they are medically. And those that will, if you live up to 5 years, probably around 75% will lose their leg. And mostly that's because it's an under-recognized problem. There's nowhere for you to go, right? You may see your GP, they may give you some antibiotics, some cream. They may not recognize the big scope of the problem. About a year later, you'll end up in my office. Then we work up the vascular side. Now we're opening up blood vessels to help heal those ulcers, but it's a continual problem. There's no home. We started doing these just procedures about 8 years ago. And by happenstance, really, we were working in our cardiology lab where the heart specialists had all the tools. We just had turned them the other way and started using them on the feet and open up 2-millimeter arteries onto the toes to cure ulcers. We started this program to fundraise and create awareness called Project Saving Legs. Right? It actually came from a cycling event that somebody invited me to, a good friend of mine in Italy called Il Taglia Gambe. At the time, we didn't know what we needed. So we started with the help of Sunnybrook and the foundation, this Project Saving Legs, and we've used it to raise money. And you know, this is our 4th year of having a fundraising ride, which really came out of our work with Team Revolution and our cycling event. And Frank Ciccolini, who started Team Revolution, and his father was a patient of mine, and he said, let me help you. Let's do a little cycling ride. And so we're in our 4th year of doing this very small event to really create awareness. And we're on track to raise $1 million over 4 years. What we've created here at Sunnybrook, again with our leadership support, is called the Vascular Limb Preservation Program. So rather than having the GPs and the emergency doctors figure out where to send these patients, they send them to one number, and there's a nurse practitioner that's in charge of the program. And his job is those patients. And he does the wound care, which we trained him. He does the referrals for the specialists. He coordinates the care. He is a navigator for these patients. When they get in trouble, they have his number. And so what we now offer is that we will determine if the patient fits the program. Within 24 hours, we feed back that we've received the referral. There's no waiting. We give instant feedback. It's a project, and it's Project Saving Legs, because you can't save a leg with a simple balloon inflation. But you need wound care, medical care, offloading devices. If you look at what it costs to heal an ulcer on these patients, the cost is about $6,000 to $8,000. This is government data for these procedures and devices to get that wound to heal. Once the wounds heal, their chance of amputation goes way down. If they need antibiotics because there's infection, the cost to our system in Ontario is about $12,000 to $14,000. If they lose their leg, the cost to our system is about $70,000. It's a huge benefit to save these patients' legs, on top of their quality of life, their dignity as people. One of my patients really pointed out, he just wanted to be able to play with his grandchildren, and he needed both legs for that. And so you forget, sometimes we all forget, we get caught up in, like, the black toe is attached to a leg that's attached to a person with a life and a family, and that's what we're trying to save, right? That's the dignity that we want to maintain.